So here we are. I keep saying this, but it's really hard to believe. This is our 10th webinar in the webinar series on COVID. And, when we decided to start doing this, I think it was right after the lockdown, like that St. Patty's Day week lockdown. So I think our first webinar maybe was on the 22nd or 23rd of March.
Something like that.
So we're like almost 3 months into this. Super interesting to me, like all the stuff that's happened this week with the Black Lives Matter movement has been pretty incredible. Not really surprising when we see what's happening in the world, that people are all being challenged right now. And last week, for those of you that stayed on through the conversation around emotional processing, it's one of the reasons I felt called to share the emotional processing work last week. We all need to really sit in our discomfort, the discomfort of whatever's coming up right now. Initially it was the discomfort of COVID and staying home and the fears around it. Now it's the discomfort is winding up, and now all of this stuff is exploding with the Black Lives Matter movement. And we can spend a lot of time looking outwards. In fact, we can spend all of our time looking outward. And what I want to encourage that we do, and when I'm encouraging you, I am 1,000% encouraging myself to keep focusing internally. What's happening with you? Where are you angry, upset, uncomfortable, and in fear, sad, whatever is coming up for you? Focus on your stuff first, and then decide what you're going to put out into the world, how you're going to walk into the world. And I'm saying that, as I said, more for myself than anybody else, because it's easy to look outside when there's so much happening. It's alive. There's a lot. But remember, what's happening on the outside is merely a reflection of what's going on the inside. Always. So I believe that this time in the world is a time of amazing, immense, extraordinary opportunity. We get to be a part of what's happening right now. And I'm going to start with me.
Mm-hmm.
So June 1, for those that don't know, June 4, I turned 51. I'm now like into the 50s. And June 1, I was like, I'm back on. I mean, I've been like this during the COVID time, for the bright line eaters that are with us. It's like really good at my bright line eating. And then like, what is it, Karen? What do you call it? Like face down?
Going snout down, going snout down into NMF.
So I've had both of those experiences where I've been doing great and then I've been snout down. And Arnie says, Arnie turned 80 yesterday. Congratulations.
Congrats!
That is not, I got nothing on you. I cannot wait till I get to celebrate my 80th birthday. Congratulations. So yeah, it's been this for sure for me. And June 1, I was like, I am getting to the place where I am going to really get my bright line eating serious, like get back to really bright lines. Karen's committed to 100 days. I'm doing 100 days. I had a little bit of a tough night last night. I still kept my flour and sugar lines clean, but my quantities were a little off. And I knew that because where my head was going. It was at a friend had a little dinner party for me, my birthday. I did go to a dinner party. So yeah, but I'm doing my writing every day. I'm really trying to do that spiritual, mental, emotional, physical work right now. Okay, so let's just hear. What did Arnie say? We hear that Black Americans are affected by COVID-19 to a greater degree than whites. Oh, you're going to comment on that?
Yeah, I've got some data on that.
All right,
too.
great. That's perfect. That's a wonderful way to sort of blend what's
Mm-hmm.
happening in the world. Interestingly, everybody who's here, we were on the call last week at noon Pacific Daylight Time, and in the midst of all of it, like everything went down. I live in Santa Monica, California, and in the midst of our conversation, it's like we had a peaceful protest. It turned into like a lot of craziness, and like I was sitting in the middle of it. And Sunday afternoon got a little hairy in Santa Monica. I was trying to decide if I should leave or stay, and I did decide to stay home. But even on my block, there was some looting that happened. And so, anyway, I hope that everyone's safe and calm and doing their work. So, Karen, do you want to give us the state of the coronavirus union?
Sure. I've got a couple of interesting things. I thought, based on the past week, I thought I would, delve a little bit into the stats on the health disparity around why African Americans are more susceptible. And by the way, you may hear some sirens. I live near a fire station. The protests in DC are huge. The city is flooded and everything is completely peaceful. There's no problems whatsoever because the president stayed home. Okay, so the problem, there hasn't been looting, it's all good. This has been a very calm weekend. And there's going to be, Al Sharpton is planning a very large march,
wow.
the end of August, last weekend in August. I think it's the 27th, 27th, 28th, something like that. And I haven't had any activity in my Airbnb. People are reaching out to me in numbers about, my Airbnb for that weekend of the big march. So COVID is still a little uncertain, but I don't think the second wave is going to hit that soon. Okay, so let me just comment, because we noticed this earlier. African Americans seem to be hit harder. And we even saw some cities initially where the African American deaths were 70%, they were huge. But now that there's been more time, I think we have now got more accurate numbers. So African Americans are about 13% of the population. So if everything were representative, you'd expect the deaths from COVID globally in the US to be 13%. It's actually almost double that. It's about 23, 24%. Now, there have been a lot of speculations as to why that is. First of all, number one, it's not genetic, because Africans are not seeing the same kind of death rates and are not seeing the same kind of infection rates as we are in the US. Couple of very important reasons: a much younger population, a population that is not very obese, and number three, a population that has its own kind of pathogens that make the immune system, this is a speculation, I'll say this honestly, the immune systems of Africans are generally a little bit more burdened, so they don't overreact, which is a big part of the problem with COVID. The obesity, diabetes, these kinds of metabolic syndrome and obesity kind of put you in a state of your inflammatory response is already turned on. So yes, that's part of it. But what is really more important to notice, and I really want to emphasize this, in the past 100 years, no matter what infection, no matter what disease is hitting people, with one exception that I was able to find, and that's osteoporosis, there are health disparities that favor the majority population. So there's nothing really unusual. Those statistics would be the same in a bad flu epidemic, in a pneumonia outbreak, with cancer, with heart disease, all of these things are mapping. And public health experts are in, they sing with a common voice saying two things. What are the two factors most important in these health disparities? Education and income. And there's also a little bit of a correlation there too. Now, what we're seeing, there was a doctor, a public health doctor, who recently wrote a book called Dying of Whiteness about rural America, predominantly white, that supported Trump, okay? Strong Trump supporters. Their health indicators have been going south for a long time. A lot of it's due to the opioid crisis. But with Trump in the White House and changes, the kinds of changes he's made, we're seeing their health outcomes also going south, okay? So an important thing here is you can almost tell by zip code how healthy and long-lived someone is going to be. So the bottom line is this is a health disparity that's reflective of all kinds of health disparities that have plagued the Black community for the past 100 years. There's nothing new and different about COVID. It's just COVID is so unusual in general, and we've had a lot more people getting it. It's the new kid on the block, so we're noticing these things. But I do want to emphasize, this is just reflective of a much larger health disparity pattern that has been in place for years. I do have one interesting new thing that we're starting to key in on stuff, okay? Things I said, a number of weeks ago. When I find something that we know now is wrong, I try to correct it. When something was just a maybe and is looking more solid, I want to try to augment it. So one thing I had been asked pretty early on is people keep coming back to hospital thinking they've been reinfected. Well, we're starting to see something. And this is something we also saw with Ebola, and we see it with other viruses that strongly manipulate the immune system, the so-called cytokine storm, immune system early overreactivity. It's called myalgic encephalitis chronic fatigue syndrome. What we're seeing, and now we're starting to see a sizable number. It started in South Korea where people came back to hospital. And the thing of it was, what it looks like now is those people never got over it to start with. They were not seriously ill to begin with, and their symptoms shifted over time. We are starting to see people now, and these tend to be people without problems, without, underlying conditions that we're aware of. And they were mildly sick from the get-go, and they tend to be younger. They're in the 20s, 30s, 40s, not overweight, not obese, no diabetes, very healthy folks. And what's happening, they get mildly ill, they seem to be recovering. They may not have a fever at the outset. They get sick again, and this time they do have a fever, or they had a fever at the first wave of it. Like even internally to these people, their illness seems to be going in waves. And this thing can go on for, we even have, the whole thing has only been known to the species for about 6 months. So we don't know how long this can go on for, but we've got people pulling into 3 and 4 months of this continuous pattern. Now they're testing negative for the virus. Many of them never got tested to begin with because their cases were relatively mild, but they're getting hit with such exhaustion. They're looking like people who were on a ventilator and came off it, right? These people were never on a ventilator, never even hospitalized. They were at home just trying to recover. And the interesting thing now, we don't know if there are still, if there's still virus messenger RNA in their bodies producing proteins that can muck with the immune system, but they're definitely testing negative by PCR. But as we've said before, PCR has up to a 30% false negative rate because it's one swab up your nose. If there's no virus right there, you're going to test negative, and it's not the test's fault. It's just that part of your body didn't have it. It could be hiding in a reservoir, but is not replication competent. It could be the virus is slightly replication competent and it's not, replicating crazy, and it's no longer in the respiratory system. It could be replicating in a reservoir, and the immune system is mostly handling it, and it's very low level. Or the virus has been completely eliminated from their systems, but the immune system hasn't kind of gone back to normal. It hasn't reset itself. Now, 40 to 50% of people who survived Ebola have similar sequelae. And Ebola does something similar to COVID with provoking a strong immune response, but it does other bad things. And Ebola is a completely different virus.
Karen, what is that syndrome called?
Well, I mean, we tend to, what's the syndrome called? Well, what they're calling it, it's more or less a default name because we see it in other things and we don't have an explanation. It's called myalgic encephalitis / chronic fatigue syndrome. People report kind of brain fog. They report exhaustion so deep, you can't power through it. If anyone is familiar with chronic fatigue or knows someone who has it, this is not where you can say, buck up and go for it. Someone who bucks up and goes for it is likely to collapse and not be able to move. Mm-hmm. So it's a problem, and it's gone on. There are now large support groups on Facebook, and people are trying to find each other. And sad to say, we've seen this with SARS as well. There are sequelae. We didn't know with SARS if it was the virus or the interferon treatment. Now, mind you, interferon is one of those molecules that sets this whole thing in motion. So it's a very understudied thing. People are often told it's your anxiety, it's psychological. It absolutely is not. And unfortunately, we just don't have the science. But hopefully this will trigger people look into that science, try to learn more about it, because we're going to have a lot of people and a lot of young people in this boat, and it's not in their heads at all.
It's interesting because it sounds like, not like my mother has Lyme's disease. She contracted it in her late 70s, but it's, and I know a lot of other people, a lot of other autoimmune diseases. And it sounds like, something that.
Yeah, autoimmune diseases have this kind of, they have this kind of feature. And again, it just depends. My brother had Lyme disease and he recovered from it. It was totally himself. He had it in his 50s. So this is what I come back to. Everybody's unique, and everybody's battle with a pathogen is uniquely their battle, right? So.
Because it's really your body against the pathogen. Not what the pathogen does, but it's what your body does with the pathogen.
It's the interaction.
Yeah.
This is something, I mean, this fascinates me from a scientific point of view, because that was always my shtick when I worked in this field, is like, you've got to look at the interaction. Clearly there are some viruses with certain potential. Smallpox is not going to look like HIV, right? They're distinct in what they do. But the manifestation of any given pathogen in any given population and any given individual is very, very variable. Yeah. So I think we're going to see more research into this. There might be some help for chronic fatigue people. Again, we don't know how that. I had a very good friend with that, and he suffered. I mean, he went on disability. The poor guy, he went from doctor to doctor and tried and tried and tried. And, they never could find a reason. And It could be the initial stimulus that caused it as long out of his body, but how to reset the response has been the challenge. And that's what he had to do. Like he worked trying to reset his response, and it helped him, you know. But again, I haven't spoken to him in a long time, so I don't know where he is today. But one thing I can certainly say with some chronic fatigue people, you can't burn yourself out. You know, it's like you need good nutrition, good sleep, stress reduction. The standard healthy behaviors are even more important in a time like this. But, you know, like, you know, this past kind of sad week, it kind of brought home to me, COVID clearly exacerbated these problems. And you've got people who were, you know, 30% of the country lost income. Some people are on the verge of being evicted. We've got people who don't know when they're going back to work, people who've lost, you know, loved ones. It's just a tinderbox. And then we have police brutality and murder, just, you know, the straw breaking the camel's back. So I'm just hoping that given the time, maybe this will be the time when change finally does happen, and we start to chip away at these health disparities. Now, I have one more really interesting thing.
Can I ask you a question before you move on? Because I'm curious about one thing.
Sure.
Is there any sort of theory as to why this reaction is
ME/CFS? Just call it CFS.
Yes, the CFS, why it's hitting young people? Like, it's just, that's the trend, or is there any thought around?
No, that does make sense. I mean, it's hitting people. It's not hitting kids, right? It is, you know, it's a different manifestation there, if indeed it even is there. It's hitting people. And again, we have to look at this because who uses social media more? It's people in the 20s, 30s, you know, 40s, right? So that's where we're finding them, finding each other. What makes perfect sense? This is like influenza 1918. These are the most robust immune systems on the planet. So when they overreact, they can overreact, right? Why they aren't reining themselves back in and ratcheting themselves back down. This is just an understudied area in immunology. We don't know. We don't even know if it's not. There is something we speculated on with coronaviruses when I was in the field, and are there fragments of the viral RNA that can still reproduce proteins, but they can't reproduce a whole viral genome and package itself to make infectious virions? We don't know. I mean, could that be happening? I think the cat virus, feline infectious peritonitis, certain things happen with immune complexes lodging in the gut and in blood vessels. That might, if COVID is doing something similar to that, I think we could probably learn something by looking at that cat disease. But again, these are speculations. It's a maybe, and we'll find out. But if it's immune hyperactivity, that's exactly the age group I'd be expecting that in.
Mm-hmm. Okay, so what was the next thing you wanted to talk about?
Yeah, I just wanted to share the screen to come back to something we talked about.
Sure.
A long time ago, so let me go. I think this is the screen I need to share. Okay, let's share that one. And I will get to my, okay, here we go. This is what we've been looking at every week, right? But now here's something really interesting. Remember those two countries that didn't want to do lockdown?
Mm-hmm.
Let's see where they are on cases per day normalized to the country population. We can see the US is right here, but look at Sweden. Okay, Sweden has now surpassed the US. Again, they've started reopening a little bit more because people voluntarily stayed home and that kind of thing. So it wasn't a perfect no lockdown. But remember Brazil? Remember Brazil? Okay, so
Yeah.
here we're seeing the two countries that said, nope, we aren't locking down. But now let's look at the worst countries on the planet in terms of per capita cases. Chile is now in the lead, followed by Peru. Okay.
What's
So
the explanation for that?
I don't know. There may indeed be one. I'm not familiar with it.
Okay.
But these two have now overtaken. Actually, it looks like Chile did a while ago. I mean, these are, they're Latin American countries, middle-income countries, probably not the strongest health systems either. But why, in particular, Chile and Peru, don't know. And that's just, I don't know. There may be an explanation. But I've been tracking these guys, okay? And what I want you to note, let me go and bring up another country just so we can get it for comparison. Okay, now here's Sweden here. Okay, now the country closest to it, Denmark. Okay, so the difference, you can't really compare Sweden and the US easily. They're completely different types of societies in terms of population density and number of big cities. But Denmark's pretty similar, okay? Two Scandinavian countries, very similar genetic background. Look at Sweden way up here. And we knew this from the start. We knew there was a lot more problem. Sweden had a lot more problem than comparable countries. Let's now look at Norway for comparison. See how they look. Okay, Norway, even more stark comparison, okay? So Sweden's way up here. Here's Sweden, and Norway's in the blue. Last but not least, because they share a border in the north, Finland, okay? So Finland is a little bit different. Okay, let's get Finland. Where did you go, Finland? Yeah. Okay, so here's Finland. Not quite as, still very similar to Denmark, but they had a slightly different take on this. And I think we can say their economy took a hit. Both Brazil and Swedish economies took a hit, not as bad as us. But as far as deaths and cases, it's, they're much, much higher in the countries that stayed open. Now, this comes down to a decision point by public health authorities and governments. What I can't show you because I don't have those stats and I don't know if anyone is even looking at them, how many people have died or will die because of the economic distress. When we add that in, now, mind you, Sweden did not fare a lot better economically than Denmark, Finland, and Norway. It was better, but it wasn't dramatically better. And there's a lot more social protection in all of those countries. Us, where we don't have a good safety net, where we're ultra-capitalistic, where a lot of the poorer people are renters who don't have the kind of protections the Scandinavian countries offer. How much additional, what we call excess mortality will be caused by the economic problems. People are estimating it. There are economists trying to make that judgment to inform the government, inform public health authorities so they can decide. But under any circumstances, at least the US, okay, let's go down. At least the US, we're still on that, this is what's disturbing to me. You saw how Denmark, Finland, all those countries are going down. Many countries are going down. We are too, but we're hanging on a plateau. Look at how long this plateau is hung. Very disturbing.
Maybe we manifested that, Karen. Because we kept saying flatten the curve. We didn't say let the curve go down. We kept saying flatten the curve. So there's a lot of languaging around flattening the curve.
Okay, well, all right. Okay.
But the curve is not really going down. I mean, a little bit, but not much.
It's not. And other countries said flatten the curve, and they're going like this. So, I mean, but here's the thing. There's a lot, people went out for Memorial Day. I was expecting a spike on that. We didn't get that. And a good thing is we have very few cases linked to outdoor transmission. We mentioned this last week, so that's a good thing. Indoor transmission is a total different kettle of fish. And even indoor transmission, when you're masked and you're in a store for 15 minutes, that's not the serious transmission. It's sharing a home with an infected person, going to work with infected people, working together, like extended periods of time, breathing the same air with poor ventilation. That's the recipe for catching COVID. It's possible to get it from a surface. We're seeing that's a lot less of a problem than we thought initially. But now let's go to some cities, okay? And
Can I ask you a question, Karen, before you move on? I'm curious in terms of what your thoughts are, your interpretation of this idea that we are, still kind of flatlining as opposed to going down. And we've seen these dramatic drops with other countries. What do we think the difference is?
I definitely think, there's a lot more, like, first of all, we have a lot of dense cities, okay? We have, a lot more resistance to stay at home than, I wouldn't be surprised if the Swedish at-risk population, I wouldn't be surprised if there was effectively very good compliance to stay at home in Sweden. People weren't socializing like they used to. I have a feeling that in the US, we were starting, as we started to turn the curve over here, I think that was around the time people couldn't take it anymore and started going out more, this kind of thing. But again, remember what the people who got hit hard fast got. Flattening the curve, there's a trade-off. Viruses are going to burn themselves out, at least any virus that provokes some kind of adaptive immunity to itself, okay? They'll burn themselves out. Now, we know not all viruses generate that kind of immune response. HIV doesn't, for example, okay? You can get super infected with 10 different kinds of HIV viruses, even if you're HIV positive to start with. So there's some viruses that just don't operate that way. COVID doesn't appear to be one of them, okay? So the flattening the curve was not meant to, protect the population indefinitely. It was meant to protect the health system and not swamp it, right, so that people wouldn't die needlessly. Well, we learned that we still had a little bit of slack in most of the health system, right? We probably didn't have to shut down as extremely as we did, but we did it, and we probably saved lives as a result. So herd immunity, we're not even close to that anywhere, and I suspect we're not going to get there until we have a vaccine. And I also I've really started, changing how I talk to people a little bit about this, because let's understand one thing. How many respiratory viruses do we have a great vaccine against? None, okay? The flu is a virus that evolves, okay? And we have to get a different flu shot every year. COVID is not as rapidly evolving, but it's going to, and it'll probably escape the first virus we make, and we'll have to get reboosted with a different style of vaccine, most likely. This is my prediction. I don't know for a fact. But what vaccines often do, like I'm thinking of the typhoid vaccine. It's an oral vaccine. It's not preventive, but it just makes the disease super mild, okay? You just feel a little sick and you recover rather than die or you're deathly ill. So that's what COVID might look like in terms of what the vaccine against SARS coronavirus 2 might do for us. It may not be as good as the smallpox vaccine or the polio vaccine, or even the measles vaccine. It might not be like that. It just might be the kind of vaccine that means you don't get super ill. And looking at these mild cases that really do have sequelae, we don't know what percent this is, it's super small, at least as we know so far, but this is far from over. So what I'm worried about now more is if this turns out to be even 1% of mild cases, that could be a significant public health problem. If we, the vaccine could prevent it, it could prevent that entirely, but mild disease appears to be something at least potentially not so mild. Like people are thinking, oh, I'm young, I'm sturdy, I'm in great health, let me get it. Well, probably you're going to get it, and 2 weeks later, you're yourself again. But there is a very small, maybe it's vanishingly small. We don't know yet. Just because there just have been a flood of cases, we're going to hit 110,000 deaths in the US today. So that's a question mark. But this, I think, we've seen this with so many similar viruses. We saw it with 1918 influenza. So this is just something I think the scientific community will have to go into more depth about. I mean, when we had chronic fatigue cropping up, was that a pathogen we couldn't detect? Was it a toxin? Was it an endocrine disruptor that disturbed the immune system and then it never got back to normal? What is it? And people tend to think, oh, it's mainly women, it's in their heads. Well, it isn't in their heads. And we don't know enough to really know what it is. So that gave me pause this past week, because I'd been hearing about that. And the reason I want to come back is people are asking, are they getting reinfected? A lot of them are in this category of an oscillating response that hangs on for days. There are people going into 80, 90 days of this. Not a lot, okay, thank God, but enough that they're finding each other and developing support groups on Facebook
Yes,
and
it's something,
Twitter.
something to talk
so
about.
It's something real and it's out there, and it's, so if you see this, if you know someone who got it and you're seeing the symptom, it's real.
Yeah.
Okay. So basically, I just wanted to take a look at how good New York is doing. I'm really happy about that. DC, Massachusetts, look at how they're going down. Massachusetts had a Memorial Day spike, I think. That something happened. Look at Massachusetts there, okay?
Brian, are you here? That's your people.
Yeah.
That's Brian and Karen's people.
Yep, and Rhode Island, luckily it's coming down. Rhode Island's even doing better than DC. I want to show you. I really want to keep an eye on DC because, I don't know, thousands of people descended on this city this weekend for the protests, and I wonder what that's going to do. Now, many of them don't live here, so they're going to go back home. But here's what DC looks like today, okay? DC kind of looks a lot like the US overall. It's starting to come down, but New York's done a lot better. Maryland and Virginia are really tracking around DC. California is still surprisingly high too, but let me show you California. They're doing they're more like New York, but I thought they'd look better by now. But I know many of you are in California. So here's California, so you're lower. But you're kind of, I don't know, you might even be rising a little bit there. Yeah, it looks like it might even be going up per capita. What I do know is happening in California is it's different places. It's kind of moving around the state. But you're still you were a lot, relative to other states, you were a lot higher. You're kind of coming down in the rankings, right? New York was clearly at the top and you were not too bad, but look at California. And again, I think I don't see an indication of a Memorial Day spike for you guys. So you probably, again, outdoor transmission, Californians socialize outdoors. Massachusetts, there aren't as many places to go outdoors as there
Right.
is in California. So there's maybe more indoor socializing, that kind of thing. Backyard picnics where people are going in the house and, crossing paths and stuff like that. Now, this is all somewhat speculative. As time goes on, we'll have more info for you. But I think companies, my own organization, we're looking at reopening, and we're going to be doing that by mid-June. The first wave of people are going to go back in, and what I'm going to do myself, okay, here's what's important. If you're thinking about, should I go back in, the 3 C's, how close are you? Are you congregating together? Is it crowded? How's your ventilation system? Are you an at-risk person? Our workplace is going to require people to take the temperature before going into work. And we're going to be providing masks at the door for those who don't have them.
So is the temperature self-monitored, or is someone taking your temp?
They're trusting you, and they're just saying, hey, if you're running a temperature, even if you're feeling great, telework, keep teleworking. Being an older person myself, I'm not going to step up and say I want to be in the first wave of returnees, not at all. I may go in once to pick up a few things and sort out for half a day. You might consider half-day work. I will probably be teleworking for most of 2020. My guess, because I am expecting, okay, what I'd love to see, I'd like us to be more like Denmark. Let's look at this other state. Let's look at, what state was that? Look at New Jersey, or New York. New York is going down. Like, what I want to see is New York gets all the way down before the second wave goes up, because the second wave starting from a lower place is better than the second wave starting from a higher place.
Are we looking at, you said you're going to look at Denmark?
No, that's just like New York. You can look at New York. So New York's going down. That's wonderful. New Yorkers got hit hard, and it's kind of like, I think they learned their lesson. They learned. So I'm going to stop sharing. Those are the things I wanted to share as.
So we have a couple of questions, and I've got a question I'll start with. And then just as a reminder for anyone who's on the actual Zoom webinar, please put your questions in the Q&A. Although I see Jean, I see your question there. We'll answer that. I do have a couple of questions that came by email. And then if you are coming to us via Facebook, please put your questions in the comments on Facebook and we'll answer them. So one of the questions I had for you today, Karen, is what we discussed about children and the children's ability to be vectors for the disease.
Oh, okay. It's looking like, and again, this is starting to seem more, again, the jury's out on everything I'm telling you, but it's looking as if children are not vectoring it. They're a little bit protected. They don't get it. We know they can get it, and we know they can have serious things, but it's the exception and not the rule. So reopening of schools, it looks to be a little bit safer than we feared it might be. We're still checking into that. So, as more data come in, we'll see. We closed schools pretty early. We did not have any indication that there was a super spreader event that started with a child. The kids that got it mostly got it from their parents who were at a super spreader event or something like that, or they were in the home. There were even children who got infected and nobody in the family had it. How they got it, who knows? That could have been that rare transmission of touching something when they're at the store, or who knows what. Well, some cases we'll never figure out how they got started. But that's a good
because
sign.
we didn't see any cases where like an entire classroom got it, or
No, we haven't seen that.
Of a school had it or something like that.
So this is a little bit more of a sign that, you can reopen schools. Again, with a mind to a little bit of social distancing, masking where possible. The younger you get, the that's becomes impossible.
Right.
But, just, the precautions of, crowding, congregating, and standing too close,
Yeah. Wow. As a mother to a 12-year-old, I very much welcome school to come back.
Yeah, exactly. Like in 12-year-old, that group can go back to school. They'll wear their masks where possible. They can keep desks. They can be told, hey, you know what
Yeah.
you're doing. Stay apart. And they'll be
Yeah, but like
fine.
kindergartners,
It's
it's
the
a whole different
5-year-old, forget about,
preschoolers. Yeah.
try to tell a 3-year-old social distance, my friend, see
Yeah.
how that
Not
goes,
easy.
right?
So I have a question here from Edward from Ghana. He says, so how long do people with asymptomatic COVID-19 recover? And are they likely to spread the virus after 2 weeks?
Okay, now are we talking post-symptomatic or asymptomatic? I want to be very clear. Asymptomatic people never had any symptoms, never knew they were sick, and they either just tested positive by an antibody test, so they realized they had an exposure and mounted an immune response. Those guys, we believe, they don't spread it. Or if they do, very, very, very little, almost negligible. But that's asymptomatic. You weren't sick, you're not getting sick, you never were sick. And those guys, the median age for the asymptomatic people is 14. So they tend to skew very young.
Wow.
So the asymptomatic people are under the age of 14, and we don't believe they're spreading it too much. But hey, 14, 50% are above 14, and they don't even know they're sick. Now, pre-symptomatic, these are the real risky people. These are the ones who are gonna get sick, but they just aren't yet. We call them pre-symptomatic. Now, where you're the most infectious is about 1 to 2 days before you feel symptoms. So you're feeling great, nothing's wrong with you, and you're particularly infectious. Now, these guys have been known to be super spreaders, right? They're super spreaders. And the event in Wuhan that was super spreading, I think we mentioned this, they were trying to break the Guinness Book of World Records for the biggest potluck dinner.
No, we didn't talk about
this. Oh, you
this.
didn't? Oh, I was telling that to someone. Well, that was a god-awful super spreader event. And they were adults, right? Pre-symptomatic adults, and the thing just exploded.
What were they trying to win the Guinness record for?
The largest potluck dinner. I mean, I think there were 12,000 people. It could have even been up to 40,000 people. I've got no idea. It was some humongous, crazy thousands of people thing.
Right.
And that was a terrible super spreading event. And the government knew they had an issue with a probably infectious agent, and they still let that thing go on. So, like I said, the Chinese could have helped us a lot by shutting this
down. They win the world
record
is the question.
Probably, I don't know. I just don't know. I didn't follow it to that degree.
That's so funny.
But honestly speaking, this is a wake-up call. We've got a new kid on the block. And, China as a society, just their particular political system isn't as transparent. Right. I just hope the hell that will start somewhere else. Now, had it started in the US, we probably would have screwed it up for different reasons, okay?
Right.
But the reality is, I hope this is a wake-up call that if it happens again, even if it's a false alarm, that every country on the planet gets on top of this, calls in the best people we have from every country, whether you're at war or not, and just nips it in the bud so we don't have the disaster that COVID is. And this is what kind of, I think, got me. I had a little bit of a depressive crash, a couple of weeks ago, when I really started to see that June 1st wasn't going to look as good as I had expected. And I think I was also starting to see this is even not just, even after a vaccine, this is changing our reality rather for the rest of my lifetime, probably forever. And God help us if this thing mutates badly. If you get co-infected, if a person gets co-infected with 2 strains of virus, and they do what's called recombine, so they have a crossover event, so that the new virus they produce is like half of one and half of the other. that could be interesting, let's just say. And I think these kinds of thoughts sort of hit me. Now, all of this is kind of wild speculation about the future, but 5 vaccine candidates are looking good. So we should get a lot better, but we're probably never going to be like we were before this thing exploded out of Wuhan.
Well, you know what, Karen? I mean, I think it's interesting because when you look back at the, um, you know, the flu of 1918. I mean, I was born in 1969, so I was born, 50 years later, ish. Uh, no, 50 years.
You were born right during the Hong Kong flu pandemic.
Yeah,
Okay.
I didn't like, there was no, my grandfather never talked about it. He was born during that time. He was born in 1919. My grandmother was born in 1919. I don't know. I mean, I could be naive, but I think the world does go back to some sort of normalcy because it wasn't like I kept hearing stories about what happened 50 years before. And it didn't.
Oh, I do, because, well, California wasn't an epicenter.
I was Pittsburgh.
Oh, okay, Pittsburgh. Okay, the epicenters, Boston, Freetown, Sierra Leone. I hear about it changed the fortunes of my family. Who ever heard of an early 20th century Irish family being downwardly mobile? Everybody, I talked about it with my friends my whole lifetime because everybody lost someone. And I bet if you could have asked your grandparents, they had talked about it. And a thing different about flu, okay? Yeah, flu kills a lot of people every year, right? And flu had been with us before and with us, it was a particularly crazy one. So it was always here and we get used to it. We'll get used to COVID too. I mean, we'll have a vaccine, we'll get used to COVID, but flu kills the old and vulnerable and the super young. COVID can hit anybody. And that was part of what made 1918 so hard. Is it was hitting the people, between 20 and 45, the most robust people. We also rebounded. Remember, there's a huge difference too. In 1918, we had 1.5 billion people on the planet. How many do we have today? And where are we going? So the population, we're going to 9 to 10 million.
Yeah.
All right, very soon. That is game changing in every sense of the word. I mean, we're already congregating. By definition, we're congregating more, we're closer. We have mega cities, which we didn't then.
Yeah.
So everything is different. And yes, I predict we'll feel a lot better and life will seem more normal. But what won't be normal is we'll have to be aware. How long has it been since anybody had to worry about polio, had to worry about smallpox? Okay, we're going to have to think more like that in those times. Now, measles, we're having to worry about that again, but not if you're vaccinated, right? There's a solution to that. Right. What we don't know yet, and this will make all the difference, is how effective the vaccines are. Yeah. If they're very effective and people get them, well, we could wipe this thing out of the population totally. And boy, would I love to see that outcome. It's a possibility. Okay, so I should look at both sides of the equation. We can wipe this thing out. Now, interestingly, economically, there was a very quick rebound after influenza, but it was different, and it can't be like that today. And why was it different? Because there were so few people at the time, and the people who died were the young working age people. Those who survived actually got raises, and labor was in shorter supply, so they were paid better. There was more immigration into the US. So, it's just a totally different world now and then. So, anyhow.
Right, but we don't know the variables yet that will impact it.
We don't. We absolutely don't.
Variables.
We know some variables. Yeah,
but we don't know all the variables yet.
We don't.
Right? I mean, we don't have a magic wand. We don't have a crystal ball.
Not at all.
So I'm gonna hold out hope.
And we may not have a second wave. We may not. I'm predicting.
What's interesting about it, Karen, is what I think about. I was thinking about this during the toilet paper shortage. the major toilet paper shortage of 2020. That now there's, by the way, a ton of toilet paper on all the shelves that I've been on. But uh, when we were having the toilet paper conversation, I kept having flashbacks to my grandmother because we would go to my grandmother's house. Every time I went into the bathroom, there was always like a square of toilet paper on top of the toilet paper roll. Because when she took too much toilet paper, she would put a square back. And I actually started doing that, like as a solution.
Great toilet paper shortage.
But that was the Depression era mentality that she had. She grew up during the time of the Depression. So I did see that impact her. Or maybe the influenza of 1918 impacted her as well. I just don't know about that. But I know how the Depression impacted her. I mean, I saw that. And I think what's interesting is that in, what year was that? Probably 2003 or 2004, I went to Croatia. That's been 2003. And I was with a friend of mine who's Croatian. And she didn't live there. She was an American, but her family was Croatian. She spent a lot of time there. She was a lot younger than me. She was like my little sister. And I was like, people are so unfriendly. I was like, I don't get it. Like, and she was like, Kristen, they've just recovered from like a major.
Exactly. Yeah, exactly.
And when you drove around, Zagreb, you would see the, bullet holes everywhere, like they were still in these old buildings. And it's like, that's the thing that I've been thinking about a lot is psychologically, like in terms of how we interact with other humans, like how is that going to be impacted? Because, and it actually makes me want to cry just thinking about it, like not being able to hug my friends makes me really sad. Like I was thinking this morning, it was like, I'm a hugger.
Yeah, no, that's something to think about.
Brings tears to my eyes.
Well, you'll be able to do that. Once you get the vaccine, you'll be doing that. But it's a different thing.
I've got Adrian to hug. Adrian's my 12-year-old. I see a text from Brian. I don't know if he's here or not, but he's texting me. So Brian's one of our regulars, for those that don't know. But anyway, it's that thing. It's like what has been weighing on me is like, how will this change the way we just be, the way we are in the world, and the way that we interact with each other, based on that experience I had in Croatia, based on what I saw my grandmother do, as a Depression child. And that's the part, if I was going to feel like go into the future, which we're not supposed to do, and start thinking about what could happen, that's the part that makes me sad about like, what's it going to be like for my son? Because we're not hugging each other now. Like, what does that do to the psyche of our, of us and our.
Well, I think that's gonna come back, partly because we're so dependent on touch. People who don't have partners and aren't huggy should be getting massages because it's part of how we stay healthy. That I'm not worried about. What I'm more thinking about is I sort of see that getting back to normal. And again, how effective the vaccine is and whether the anti-vaxxers go nuts or whatever. What I'm thinking about is just how we think about our safety in the world. Like I don't go out worrying about catching measles because people aren't vaccinating their kids. First of all, I had it and I've been vaccinated I don't know how many times. But even with a COVID vaccine, I might think I got to watch it because of the mild symptoms can be awful, right? So
right.
It's that kind of thing. And again, there may be no, we shouldn't go into the future. There's just too many unknowns. But here's one thing I'm really hoping for, is that it's a wake-up call, both economically, for the social safety net, for public health, and that, okay, even if we have to be more thoughtful about our health risks from infectious agents, which we haven't worried about. Well, we worry about AIDS a lot, but, we haven't worried about airborne viruses in a long time. But maybe we'll have to think differently. But if that's a small price to pay for better surveillance, for better protections for vulnerable people, for a better, unemployment system if something happens. I mean, I'll gladly pay that price to raise the quality of life of people who are marginal to start with.
Right.
So
We won't be
that's
able to get to
what
our
I'm
other
trying to think
questions.
of.
We got philosophical here. Anyone can jump in.
Yeah, maybe a little, and that's all
There,
speculation.
one
That's
more question on the, we got a question from Jean. We've got a question from Brian on Facebook. So I think
okay.
Brian is here. Lindy, I saw that you jumped on to Facebook. If you're still here, look how beautiful the roses are. So my friend Lindy got me these beautiful roses
For your birthday.
for
Oh,
my
I see
birthday.
them. They're
Look,
lovely.
they match my lipstick.
Okay.
And
Can you turn your screen so we can see, the roses are a little cut off. Oh, beautiful. Yeah,
but my lipstick matches them, which I think is so funny, right?
I like that.
So Lindy, so for those of you that live in LA, I'll send you the information if you want, but there's a company, I'm gonna screw the story up, but there was a friend of my friend Lindy's, has a business, and his business is next to, in the, warehouse district, is next to a family that has an Ecuadorian family that was a flower business, and they would import flowers from Ecuador, and basically their business was lost, like down in downtown LA. And he had this idea. He's like, hey, let's take the flowers out to the people. So every day they have a truck in front of different people's homes, and people are lining up for these beautiful, beautiful flowers. I don't know what else they have, but I got these, and these are called Pink Floyd.
Okay.
Another Lindy wanted to buy me these really beautiful ones that were tie-dyed roses that were.
Oh, I've seen
They were
those.
out of them. They were gorgeous. Anyway, I'll share that link with you guys. Okay, so let's do this. Brian, I guess you're here because he has a question, but I'm going to answer the other question that we got from, Marge. Marge sent a question. She said, our restaurants have reopened, and I'm wondering if it's safe to meet friends for breakfast. I'm not sure how to assess the risk of this. It would be indoor dining, and 3 of us would sit in a booth.
Yeah, that's very tough. The question comes down to, restaurants are even required to keep tables apart. First of all, it's indoors. How long are you going to stay there? The reality is, you don't know who else is there. You don't know if there's a pre-symptomatic person who's just fine and enjoying some time with their friends. You don't know if the ventilation system is excellent or crap. Personally speaking, I'm not going to do that. I'm going to go to a place where we can be outside. And like in DC, there isn't even any indoor seating yet. Restaurants have reopened, but only outdoor seating. And they are expediting the licenses for those who don't have outdoor seating, who want to just go out onto the sidewalk. And I walked down Pennsylvania Avenue just the other day. A very popular Mexican restaurant was pretty crowded outside. But again, outside is very good air circulation, So all I can say is, were you in an area that had a lot of cases? Where are your case numbers today? The recipe for contracting it is breathing aerosols in the air, singing, talking, being together with infected people in close spaces for extended periods of time. You have to make the judgment. I mean, I would say, if you like that restaurant and your friends are COVID free, why not just have the food delivered and enjoy some fun at somebody's place? That's what
Or maybe
I would
find
do.
a restaurant that has an outdoor.
Or go to an outdoor seating restaurant. If you love that particular restaurant, do take out and have a picnic in a park, or that's a lot safer. That's what the restaurant industry is also very worried about this, because even though they're open, it's going to be a very long time before I feel comfortable going to one.
So it's interesting because for my birthday last Thursday, went to a restaurant and we sat inside. And I didn't even know that you could sit inside. I thought there was only outdoor seating. This restaurant doesn't actually have outdoor seating, but I had heard a couple of days before. This restaurant has the front of the restaurant is screens. Like, it's not a garage door.
Okay, great ventilation.
They're like garage doors. Now the back is
Okay.
open because the kitchen's in the back. They have a side door that was open. So this, and then they did a very, very good job of spacing people out. I mean, we were not near anybody.
Yeah, that restaurants are mandated to do that.
And they really were
However,
doing it. People were walking, wearing their masks if they were walking about in the restaurant.
okay.
So who knows? I mean, I was
Yeah,
also
it's a
at
who
the
knows.
restaurant.
And there could have been good ventilation. If they had good ventilation through the kitchen, what they would be doing would be pulling in outside air, pulling it out through the kitchen. And that's actually very safe.
Yeah.
That's,
So
quite
I
a
did
safe
do that. But
situation.
what I said to my aunt when I was walking out was like, that was really awesome. Like, it was so fun. It was a great birthday treat to be in a restaurant after 3 months. But I would not be doing that every day. Like, I'm not going to be like,
Right.
I'm not going
Yeah.
to be going to a restaurant every day. That is more of a treat. That is not something I'm going to do all the time. But it was nice to do it.
Probably I'm going to do that, in outdoor seating with some friends. I'm definitely going to go, but not indoors. And honestly, as we start to see more, as the restaurants open up, I mean, I just can't, you can't tell which restaurant does have good ventilation because
Yeah.
often there's big buildings and some of them are fantastic. And and another thing, this is what I always say. If nobody entered that restaurant all day who was pre-symptomatic, then you're not going to get, I mean, you don't get it magically out of the air. Without an infected person being there, there's no spreading. And that's just, who will ever know that? So that's the
Yeah.
whole thing about infections,
So Brian has a
contagious
question
diseases.
for us, and then Gina has a question for us. So
Okay.
let me go with Brian's first, then I'll go with Jean. Brian says, hello, ladies. Quick question, which, given that I joined the webinar a bit late today, may have already been touched upon. If so, my apologies. Karen, given the tenor of our current times, pandemics, economic tumult, civil unrest, meteor flybys, we're all under a tremendous amount of stress. How much research has been done and to show how stress affects susceptibility to and the expression of the disease? Have there been any significant findings in this realm of study? If so, what is the theory?
Okay. In general, for COVID, it's just too new. I don't think there are studies, but there's a huge amount of research on a correlation between, you know, getting sick and stress, and it's positive and it's there. Okay. And the theory behind it is weakened immune response. Okay. That's a theory. And again, when you're stressed, often you're not sleeping well, often you're not eating regularly. So it's not even just the stress alone. If it were just stress, but you were getting a good night's sleep and great nutrition, we almost can't study that because that doesn't happen, right? When you're stressed, everything kind of falls apart a little bit. And the evidence is very clear that stress contributes to a lot of, there's strong evidence that every form of disease is impacted by stress. There's evidence that your lifespan is affected by stress. There's evidence of quality of your life affected by stress. So that's incontrovertible at this point, Brian. So Massachusetts is looking good. It had a little Memorial Day spike, it seems, but things are looking better there overall.
He's in Santa Monica now, though.
Oh, now you're just originally
Yeah.
from Boston. Okay, well, I understand that. Go Red Sox. But okay, you're now a Californian. You're a
He's
transplant,
also a
but
Patriots fan.
you'll
Boston.
always be a Bostonian, Brian.
Yeah.
I'm sorry. You can enjoy that beautiful California beach, but get you on a flight and you'll be dropping your eyes and going to the Red Sox games.
Yeah, he will be.
Yeah.
So I had a follow-up question to that now. It's just.
Oh yeah, we have one from Jean. Or is this about?
Hold on 1 second on the stress.
Okay.
Hold on 1 second on the stress, and then let's get to Jean. One of the books that I follow all the time, and Karen, I don't know if I've ever pulled this out with you or not. It's a book by Louise Hay, and it's called "You Can Heal Your Life," and it's really her work based on the mind-body connection, how we create disease in our body, and disease is often started with some sort of stress. So, if anyone wants to just kind of play around with that, look at that. It's really, the book is interesting because it'll have whatever the disease is that you're experiencing and what the probable cause is, and then a new thought pattern. So I'm a believer in that. Louise Hay she died last year. I think she was in her 80s, well, in like 86, well into her 80s. And she had cancer as a relatively young woman and healed herself.
Well, you know, another person who's great to read on that, I think her book was called Dying to Be Me or something, Anita Moorjani. She had a very interesting near-death experience, and she feels she basically gave herself cancer.
Yeah.
You know, she was so terrified of it, she gave it to herself. She had very serious lymphoma and was this close to dying, and she cured herself too after her near-death experience. So her book is really fascinating.
Also,
Yeah,
the emotional processing work helps with stress. Brian, you know that. Okay. So Jean says, or asks, when are you guessing the second wave will start?
Yeah, my guess, I mean, we could have a second wave in July if practices change. If it's like the flu, if it's like respiratory viruses, I am still holding out for the heat and the sun predisposing to a little bit lower caseloads. I'm expecting it October, November, kind of when flu season starts up. That's my expectation. And I also see a question about best practices for air travel. See that one here too from Elizabeth. Okay, air travel, that's a really, really tricky thing. And again, here's why. I want to say one thing about air filtration in planes. It's some of the best on the planet, right? I mean, they use HEPA filtering. They bring in outside air, and God knows that that's clean, right? So the filtering system in planes is superb. Okay, it's better than what you're going to have in a regular building. And it's also, HEPA filters can filter out droplets. I mean, they can block viruses, whereas nothing else really can. It's like the airplane filtering system is like an N95 mask, right? However, how close are you to people? And you know, they're coughing, they're sneezing. If there is a level of fomite transmission, people are touching a seat back. We don't think fomites are the main thing, and fomites is surfaces and hair and clothing and whatever. We don't think that's a major thing. But what would be the type of thing that would predispose to it? Being cooped up in an airplane in close quarters. Now, some airlines have promised to keep the middle seat free, which they have not held to, okay? So if there really is going to be nobody in the middle seat and your flight is a little bit short, well, okay, it's probably safer, but I would say there's just no best practice for air travel. You know, there's better. If you must travel by air, you know the drill. The airline is already doing its best in filtering the air. It's very good. But can you be sure that the person, you go into a bathroom and the person before you had COVID and was coughing in there, I'd say you could easily pick it up because it's a very confined space, not well ventilated, and there would be droplets and aerosols right in there. So masks, we know masks are not designed to protect you. They're designed to protect others. So even if you had a mask on, you could still give yourself an infectious dose. So if you've got a short flight and it must be done, just think about that. Minimize moving about, get on and off, last one in, first one out, do the best you can. But it is a recipe. Air travel is a recipe for problems, even if the airlines agree, if they hold to their agreement not to put people in middle seats, because then all the other seats will be full. There are so many flights canceled that every flight that goes out, they're trying to pack. So I'm not getting on a plane anytime soon. I would take a train where I can open a window, take a car, something like that. But again, everybody has to weigh these things for themselves. If there's nobody sick on the plane, if nobody's infected on that plane, then you have zero problem. Oh, that's a cool idea. It's tough, you know, that air travel thing, it's very, very tough. You know, it's just, Kristen, you're muted.
I just put a poll up. I thought I'd put a poll up because we were
Very
talking
cool.
in the beginning of this conversation. If, you know, do we want to continue these? Is there a need for them still? I mean, today was quite a lively conversation, I thought, and I thought you had some great information, Karen. So for those who are on the Zoom webinar, I've just put up a poll. Are you interested in still doing these? And if so, how often would you like them to happen? So that we can kind of just take a look at that to make a determination. I mean, we're still getting close to 20 people on the.
Yeah, because it's getting harder for me to find new info.
Yeah.
So it really depends on you guys. We're starting to validate stuff that's coming in, and you know, we're sharing opinions. It's good to sometimes to think it through together. So many of these decisions, they're personal decisions based on your needs. I mean, if I had an emergency, I'd get on a plane, but I'd know what it's all about. I mean, I would understand what might be, but I'm putting myself in a little higher risk scenario. My sister, who's a caretaker for my 85-year-old mom, she's a little concerned getting back into work. And she takes the boat. She lives on the South Shore of Boston, and she takes the boat to work. And I said, okay, think about it. How well can you open a window in your office? Are there visitors in your office? Can you work half days? Can you be outside on the boat? Don't go inside to the cabin part. You know, like think through what your process has to be and weigh the considerations.
Just so you know, if anyone wants to weigh in on the poll, it'd be helpful for us.
Yeah, definitely please fill in the poll.
Please fill it in so we can see where you are. We got 8 answers out of 14, 8 out of the 14 people that are here currently.
Yeah, please, if you're still here, just help us because, you know, it is getting harder. It's getting warmer weather.
And if you can't
want to go out.
How did the poll pop up for you?
It was just a nice poll. I filled out the poll. I did the poll.
Oh, you did? Awesome. So yeah, if all of you could do that, that would be helpful to help.
It just comes right up, a nice.
And actually, I said each week, bi-weekly, monthly, or all the above. All the above probably isn't that helpful.
Yeah, or like it just means you like them all. You're not helping us
but
decide.
maybe that doesn't help us with the answer.
Okay, let's see what happens. Let's see.
Yeah,
what
I guess
you
we got
get.
11. We got a couple more people coming.
We appreciate that. And if you can send it on Facebook if Kristen can see it on the Facebook
comments.
page.
If you're on Facebook, you
make a comment.
Like, you know, yes or no, and then how often would you like it? Right now we have 1 for each week, 5 for bi-weekly, 2 for monthly, and 3 for all of the above. So maybe bi-weekly, like we could do it.
Okay, sounds like, you know, whichever one wins where people care, it sounds like the other people didn't mind at all. Yeah. You know, so let's see if I'm seeing anything on my Facebook page.
We've got 11 responses right now.
Yeah, sometimes people watch on my Facebook page too, so I will go and see if I see that.
Isn't this fun?
Oh, yeah.
So, I mean, I think that maybe we can switch to like we'll do it 2 weeks from now, and then we'll kind of test Oh, Brian Freight says yes, more. Brian, are you okay with bi-weekly?
What does that mean, Brian?
Can you be more specific, please, Brian? So does anyone else, we still have a few minutes. Does anybody else have any other questions, thoughts, comments, stories? This is an open forum. Any more responses? We got 11. Does anyone have a problem finding the poll? I know for me, the poll is down in the bottom. There's a poll in the bottom search engine of Zoom, like along that same line where you stop your video. Brian says, What are you ladies doing tomorrow?
In terms of like going
Like
to
he
work.
wants to do another webinar tomorrow.
Oh, I just think like I'm going to work.
He wants every day. I don't know what we talk about,
Well,
Brian.
we should add Brian to the Marco Polo group because that's been a little quiet lately, but
Yeah.
I'm going to start going back onto that. What I had been doing on the Marco Polo group is I subscribed to Blinkist, which is like a little kind of a, abbreviated Cliff Note books. And I was actually playing blinks from Michael Osterholm's book on public health. And what I think that's great, it really puts things in historical perspective. Because as
Yeah.
we've said all along, there's nothing new here. We're expecting this.
Karen, Diana Brown has raised her hand, so I'm going to allow her to talk.
Diana, take it away.
Okay, Diana. Hi.
I probably didn't mean to.
Well, now you have to say something.
But I
No worries.
But I did have a question for my niece who has a 2-month-old baby.
Oh.
Does she need to be fearful of other children coming to her house because she has other children, going out in public? What would you say to her regarding COVID?
Regarding infants, we know next to nothing, okay? First of all, because they are so protected, I have not seen any report about an infant getting infected with COVID. Haven't seen anything, so I have no knowledge, no information. I would be careful, I wouldn't let the baby, just in general, people are much more protective about babies than than older kids. So I would use normal baby protections. As we said about going out, when you go out, outdoor transmission is the least common thing. I wouldn't let people be touching the baby and leaning in, kiss the baby, that kind of stuff, though you're probably not going to let that happen anyways.
Yeah.
Beyond, family members. So I would say, normal baby precautions, maybe even a little more than usual, but I just don't have enough. I haven't seen anything that I can give you authoritative information about.
Okay, thanks.
Thanks, Diana.
Mm-hmm.
I don't know if I did what I was supposed to do.
I'm actually more worried about pregnant women. But one good thing about pregnancy is a little bit immunosuppressive. So I'm really looking forward to see how, when all is said and done, we have numbers of pregnant women. I wouldn't be surprised if they have a better survival rate because their immune systems don't go into overdrive. I'm curious. I don't know what we'll see, but again, babies, they are protected by maternal antibodies early on, right? That's what they're getting in the breast milk, but chances are their mom doesn't have them anyhow. So.
Right. Well, I remember, when I got the swine flu, I was still breastfeeding Adrian. And I was so sick. I was sick, just really sick. And my business partner from Kenya was with me and he got it too. We both were so sick.
Oh, that's a bad flu.
Still breastfeeding, yeah.
That's a bad flu. Bad flu.
So if there are no more questions.
Okay, someone want, it's Marco Polo.
Oh, yeah.
Marco Polo group.
Is there a link that we can give them to do that? How do we do that?
I don't know how to get people. I can get you in if I know. I think I need an email. Right? Yeah, phone number I think I need your phone number. So if you want to get in the Marco Polo group, I sometimes do a polo a day. Like I haven't done it in a long time, but I'm planning to restart it.
Yeah.
And then
So if you want to be in Karen's Marco Polo group, send me your phone number. And so it has to be a mobile number, right? So Marco Polo is an app. And in that app, it's connected to your phone number. And it's instead of like text messaging, it's video messages.
Mm-hmm.
And
so you have to put the app on.
Specifically about the virology of, well, here she goes. Karen, can you grab her number right there? Jean just gave her number.
Okay, I'm going to write it down. I don't have my cell phone with me, but I'll write it down. Let me try. You got to put, it may not get Marco Polo onto your phone because I'm not sure it's going to recognize this until you have the app because you're going to be linking.
You know what it does? I
at
know this because
Marco
I've done this with
Polo.
other people. If
Oh,
you
you've
send
done it?
her-
Okay.
If you put her in, it'll
Then it
send
sends
her
an
a
invite. Okay,
text
okay,
saying,
it sends a
will
text
you
message.
join Marco Polo? That might be the easiest.
Okay, okay. I'll do that. I'll put you in.
Yeah.
I'll put you in and then we see what happens, Jean.
Perfect. Okay, well, I think, Karen, are you okay with doing this in 2 weeks?
Absolutely. You know, I was
was thinking,
okay.
I was like, do
I
we wanna
just thought
switch-
people would be getting tired of doing it weekly.
Right, and then I was
'cause they
like, should
might
we
wanna
switch
go
the
out.
time? That should have been another question.
Okay, is this
Should we
time
switch the
good?
time? I mean, I'm not going to change the poll now, but there's a possibility that we could do it earlier, or I don't know. Then that's midday for you. So
Well, 3 o'clock, I mean, to me, I'd rather go later. Like 4 p.m. is okay. 3 or 4 earlier is not that good. So it's very perfect for me. But
Okay.
I could do your 1 o'clock. That would be okay too.
Yeah, I mean, for me, it's kind of midday, but I'm okay for right now.
Yeah, if you want to go a little later, would 1 be better? Would 1 be a better time?
Yeah,
for
like
you?
better for me would probably be like 4.
For
'Cause
your
like
time.
the day's over. Not over, but
Okay, that's too late for me because I'm usually doing special stuff by then because that's my 7 p.m.
yeah. Anyway,
Yeah,
it's fine
so-
for now.
But it's
All right,
okay.
thank you for listening.
We'll manage.
All right.
Okay,
So
well,
sending
nice
you guys
seeing
lots of
everybody.
love and peace and health. And we'll
Absolutely.
see you in
Make
2
it a
weeks on the
great week.
21st of June. Okay.
Okay, bye-bye, everyone.
Bye-bye. Bye.